This is the case of dilated coronary sinus due to persistent left-sided superior vena cava. This is parasternal long axis view. The patient is only 4 days old neonate. This is left atrium, this is left ventricle, this is right ventricle. This is main pulmonary artery, this is a place of aorta. This is left atrium, and this part, this is coronary sinus, dilated coronary sinus, and this is descending aorta. This is ascending aorta, and this is descending aorta. Posterior to left atrium, this is descending aorta, but here in left atrioventral groove, this part is dilated. This is coronary sinus. Most common cause of dilatation of coronary sinus is persistent left-sided superior vena cava. So that left-sided circulation, venous circulation drains to left-sided superior vena cava, that drains into coronary sinus, and that drains into right atrium. So finally drains into right atrium. Ultimately is normal finding in most cases, but in this case there are so many other findings also. So in this case, what I wanted to show you, this is the dilated coronary sinus. Whenever you see this kind of coronary sinus thing, this is dilated coronary sinus. This is descending aorta. This is just this kind of image you will see in almost all cases, almost all patients. Again, same image, next image, same thing, almost same thing. This is dilated coronary sinus. This is descending aorta. This is, you see, this is the main pulmonary artery, this is aorta, this is aorta, this is the main pulmonary artery, this is right pulmonary artery, this is left pulmonary artery. This is parasternal short axis view. Left ventricle chamber is D-shaped, indicating increased right ventricular systolic pressure. This case has got severe pulmonary artery hypertension. If there is no pulmonary stenosis, RVSP severely raised, that means severe pulmonary artery hypertension. This is TRZ, RERV severely dilated. When RERV dilated, this is coronary sinus in this image. This is BST. BST has bidirectional flow. BST bidirectional flow. This is main pulmonary artery. You can see 4-chamber view. In this image, you will see this is coronary sinus, this is coronary sinus. That is coming anterior to left pulmonary artery. I want to show you in moving image. So this is coronary sinus, just moving. This is again coronary sinus. This image, coronary sinus. This is coronary sinus. This is coronary sinus. This is coronary sinus, anterior to left coronary artery. This is right pulmonary artery, left pulmonary artery. This is aorta, descending aorta. This is coronary LSVC. The left side is vena cava draining into coronary sinus. So whenever left side vena cava draining into coronary sinus, that is the most common cause. The most common cause of dilatation of coronary sinus. That will be anterior to left pulmonary artery. If that is anything that is posterior to left pulmonary artery, then that will be pulmonary vein. So if pulmonary vein is joining coronary sinus and that is dilatation of coronary sinus, in that case, that will be the posterior to this bifurcation. That is the point to know by the image. If anything that is anterior, that is joining into coronary sinus, that is persistent left sinus vena cava. How you will confirm? This is confirmed by putting Ayer's enormous line contrast. Just you agitated enormous line into left hand, left ventricubital vein. The first structure that will take contrast will be coronary sinus. Then that will go into right atrium. So that is how you diagnose left sided superior vena cava draining into coronary sinus. Because if you give any contrast into left hand, that will go into left sided superior vena cava, that will go into coronary sinus, and then the RE and RV will be take contrast. So first structure that will take contrast will be coronary sinus, and then will RE and RV will get contrast. If it is not the case, suppose there is no left sided superior vena cava, then RE and RV will get contrast, and coronary sinus will get contrast, very less contrast, and that will be even after RE and RV is already getting contrast. After then, coronary sinus will get little bit contrast. So this is the finding by image wise, and second thing by contrast way, how to giving contrast into left hand, taking seeing that which structure is getting contrast first, that will show you whether the left side vena cava draining into coronary sinus or not. So in moving image, this is left side vena cava, this is coronary sinus again, this is left side vena cava. So left side vena cava joining coronary sinus, because that is anterior to left pulmonary artery. So any structure that is anterior to left pulmonary artery or pulmonary bifurcation joining coronary sinus, that means left side superior vena cava. If it is posterior, then that will be, that is pulmonary vein joining coronary sinus. This is the case where DST, double outlet right ventricle, left sided superior vena cava draining into coronary sinus, severe PAH, RERV severely dilated, S-test pattern foramen novel are the findings in this case. Thank you.